Sleep disorders are a worldwide class of disorders that affect millions of people daily. Sleep disorders are important to know about, as you may possibly have one and not even be aware. We hope this video teaches you the symptoms of narcolepsy, sleep apnea, night terrors, nightmares, and somnambulism, how they can relate to each other, and how they affect people. The following videos are not meant to offend people. They are used for viewers to be able to see the symptoms of the sleeping disorders.
Rohan, wake up.
Have you guys ever heard of narcolepsy? It's a chronic neurological disorder that affects the brain's ability to control sleep and wake cycles. All narcoleptics have three symptoms: excessive daytime sleeping, sleep paralysis, and hallucinations. Excessive daytime sleeping is obvious. It's just when people go to sleep during the day more than normal. And usually, people can go from normal arousal to REM sleep in just 15 minutes. During sleep paralysis, it's kind of similar to the REM inhibitions. The body freezes up and the bones get cold, and this usually happens while the person is falling asleep and right after they wake up. Sometimes, during sleep paralysis, people see vivid images, which are the hallucinations that occur. Symptoms usually start for people who are around the ages 7 to 25. However, it can last throughout a person's lifetime. Now, there are two types of narcolepsy. Type 1 narcolepsy shows low levels of hypocretin, which is a hormone that regulates arousal. It also shows that there's a loss of muscle tone, which leads to a lack of muscle control. Type 2 narcolepsy shows almost normal levels of hypocretin. It doesn't have very severe signs. However, there still is a lot of excessive daytime sleepiness. The main cause of narcolepsy is a lack of hypocretin, the hormone we discussed earlier. Usually this is caused by autoimmune disorders which kill cells that release the hypocretin. Around 135 to 200,000 people in the US alone have narcolepsy. So now let's move on to the diagnosis of narcolepsy, and there are two ways to do that. First, there's a polysomnogram. This usually studies a person while they sleep and identifies different brain activity. Also, there's a multiple sleep latency test, which requires the patient to take 5 naps within a day, and each nap is separated by 2 hours. If the patient falls into REM sleep within 15 minutes of napping for at least 2 naps, they are diagnosed with narcolepsy. Now, treating narcolepsy is a hard thing to do because it's kind of impossible. However, you can always limit the amount of the effects of symptoms. You can always change your lifestyle and exercise regularly and keep a sleep schedule so that it will limit the effects of narcolepsy. And if you want to take medication, you can usually take stimulants and antidepressants to limit the effects of narcolepsy. Now that we've looked at narcolepsy, let's look at another disorder, sleep apnea.
Not again.
Sleep apnea. Sleep apnea is a common and chronic disorder that involves one or more pauses of breathing during sleep. The most common type of sleep apnea is obstructive sleep apnea, when an airway or a pipe becomes blocked, and any air that squeezes through the blocked pipe will cause loud snoring. Sleep apnea also has a high correlation with night terrors and nightmares. People whose throat narrows more than normal while sleeping, are overweight, and have tongues and tonsils larger than normal face an increased risk of getting sleep apnea. The main symptoms are loud and chronic snoring. Sometimes pauses may occur while snoring, and then the people may start gasping for air or choking. Other symptoms of sleep apnea include fighting sleepiness during the day, headaches, a lack of concentration, and a sore throat when waking up. When it comes to treatment, there are 4 ways to help people with sleep apnea. Avoid alcohol and barbiturates, lose weight if obesity is the problem, and to quit smoking. Breathing devices such as CPAP can help treat sleep apnea by blowing air into the throat if it's blocked.
Somnambulism, or sleepwalking, is a disorder that involves a person walking or performing a complex action while in REM sleep. It is more common in children than in adults. Somnambulism isn't very common. Around 1 to 15% of people have it. Common triggers for sleepwalking include sleep deprivation, sedative agents including alcohol, febrile illness, and certain medications. Some symptoms of somnambulism are sleep-talking, little or no memory of the event, inappropriate behavior, and sometimes violence. There are no real treatments to somnambulism, but one can cope with somnambulism. To lessen the occurrence of sleepwalking, one can increase the amount of sleep they get and creating a safe environment to prevent getting injured. Another way of decreasing sleepwalking is by hypnosis or antidepressants. A sleepwalker should be awakened while they are sleepwalking despite what people say.
Jake, what's wrong? What's wrong? Oh.
Night terrors are a sleep disorder in where a person partially awakens in a state of terror. Night terrors often occur during the first half of the sleep cycle. They do not remember themselves having the experience from the night before. Usually, children experience night terrors. When children experience night terrors, it's usually because they have a lack of sleep, pharmaceutical side effects, head injuries, or stress. Very few adults experience night terrors, but they experience it if they have PTSD, bipolar disorder, depression, anxiety, and extreme stress. Night terrors accompany sleep disorders such as sleep apnea and insomnia. When someone is having a night terror, it is important to soothe the person instead of making them fall asleep. Different kinds of therapy such as CBT, biofeedback, and hypnosis can help a person cope with stress causing night terrors. If needed, a doctor may prescribe benzodiazepines, which are barbiturates, to help the person sleep. Doctors will place a heavy restriction when the patient is using it because medication becomes highly addictive. Last but not least, you can even use relaxation methods to calm yourself down. Nightmares. Frequent nightmares are considered parasomnias, which are sleeping disorders that involve unwanted experiences or events that occur in someone's dream while they are sleeping. Nightmares also make it seem that a dream is coming to real life, causing someone to wake up. Usually, nightmares leave a person feeling nervous, anxious, frustrated, angry, or other negative feelings. Risk factors for nightmares include another sleep disorder, a medical condition, negative feelings, antidepressant side effects, or side effects. 2 to 8% of people having nightmares cause problems. Around 50% of young children between the ages of 3 to 6 have nightmares. For most of these children, nightmares will decrease in frequency and intensity. 50 to 85% of adults have stated that they have had some nightmares at some point in their life, and more women get nightmares than men. To get a diagnosis of nightmares, it is important to keep a sleep diary, but more importantly, check with sleep specialists to get an accurate and professional diagnosis. One way to get treated for nightmares is counseling. Psychoanalytic therapists can also help by analyzing which causes nightmares in people. Another way to get treated with nightmares is going through systematic desensitization, which in this case is having the patient exposed to traumatic dreams and have them react. Last but not least, people can manage stress properly to reduce the occurrences of nightmares.
I hope this video helps you understand the importance of sleep disorders and how it affects millions of Americans every day.